Let's talk about the 8 dangerous signs that you should never ignore. Now, before I begin, let me just give you a disclaimer. Now, make sure you check with your doctor before implementing the suggestion of checking with your doctor. Well, maybe I don't need a disclaimer in this video. But anyway, if you've been watching my videos, sometimes you might have got the impression that I'm against medicine or medical doctors. That is absolutely not true. I respect medical doctors. I respect competent medical doctors. When I busted my elbow in an accident, they took me from a very serious situation where I had 30 little pieces of bone fragments and put me back together again. So I'm able to use my elbow. So I highly respect competent medical professionals. The challenge I have is with the system in general and just the lack of emphasis on your foods and nutrition. It's just not taught in medical school. And unfortunately, Big Pharma has too much control over the medical profession, in which these drugs can be set up to last only 24 hours, and then you got to take another drug. And unfortunately, it's this kind of setup where the patient is becoming an ATM for Big Pharma. But let me just get into the 8 dangerous signs that you should never ignore, and you should go see your doctor to get more information. Number 1, a cough. Now, there is acute coughs, which only last like 3 weeks, and they usually go away by themselves. You have subacute coughs that could last 3 to 8 weeks, okay? Then you have this chronic cough, and the person's like just always clearing their throat, and they're coughing for a long period of time, usually after 8 weeks. Now, if you've tried everything, you've tried zinc, you tried vitamin D, you even tried calcium lactate, which is a non-dairy type of calcium, which works really good for these chronic coughs. And if that still has not resolved the cough, then you need to go get it checked out and get more information, especially if there's difficulty swallowing, if you have a fever, if you check and your lymph nodes are still enlarged, there's something going on, and especially if the cough is getting worse. All right, number 2, hold on a second, let me just make sure you see this right. Oh yeah, loss of vision. That was my dry sense of humor. In one or both eyes. That could potentially be a blood clot in the retinal artery, okay? Which could mean various things. It could mean that you had a TIA, which means you could have had a mini stroke or a transient ischemic attack. Now, the problem with a mini stroke is that you may be at risk of getting a second stroke. In fact, if you had a mini stroke, there's a 17% chance that you may have another stroke within 90 days. So you want to get it checked out. Anytime you have a stroke, you want to get to the emergency room as fast as possible, so then they can give you a certain medication to thin the blood and prevent any further damage. Now, it could be a brain tumor, it could be glaucoma, it could be any number of things. I remember I had a patient whose husband was coming in with her, and he just had the worst diet in the world. In fact, one day he let me check him out, and I had him lay on the table and I was checking him out, and his extremities, his arms and his legs completely went dead. His extremities just lost feeling and function, okay? That's a bad circulation problem. You would think he would do something about it. No, he was an expert at ignoring these symptoms, okay? Until eventually he came in blind. Well, guess what? He had diabetes, and he didn't do anything about it. He didn't change his diet. He didn't do anything. So now he's blind. So a loss of vision could mean something related to diabetes as well. All right, next one. Drooping or weakness on one side of your body, all right? Now, that could either be that you had a stroke, or it's an early sign that a stroke is on its way. And over 7 million people a year die of strokes. Now, there's an acronym, FAST, where you have F, which is face droop, okay? A, arm weak. S, speech difficulty. Means T, time to call 911. So that's an easy way to remember it. All right, number 4. Let's say you have this changing mole, okay? This mole on your body that is starting to grow, okay? That means you need to get it checked out, because you want to rule out something called a melanoma, which is skin cancer. Now, there's another acronym I'm going to show you. It's A, B, C, D, E, okay? Let's start with A. Is it asymmetrical? So usually with a mole, you have a very symmetrical shape, all right? But with melanoma, it's usually asymmetrical. All right, the border around a mole is very smooth and even, but the border around a melanoma is very rough, it's jagged, it has a non-smooth border. All right, C, a melanoma will have different colors, okay? A mole pretty much stays consistently the same color, kind of a brown or darker brown, but a melanoma could turn like yellow, blue, green, red. So if you see your mole changing, then get it checked out. Okay, next one is diameter. When you have a melanoma, the size of it is usually greater than 6 millimeters, okay? That would be about 1/4 of an inch or the size of a pencil eraser. But if you have a penny, it's about 1/4 of that because a penny is about, I think it's 19 millimeters. So it'd be 1/4 of a penny. So moles are smaller, melanomas are larger. All right, E, evolution. Is it changing? Is it evolving? Is it a growing? Suspect melanoma? Get it checked. Now, just so you know, I did a video on melanomas and I talked about sun. You can watch that video. I'll put a link down below. You know, there's a lot of opinions on sun, but sun has a lot of great therapeutic benefits. But when you're out in the sun too long and you get burnt, that's when you can start increasing your risk for certain types of problems with the skin. But if you're not letting your skin burn, it can be very therapeutic in different ways because sometimes the people are so freaked out, they stay in the house all the time, they never go out in the sun, and they don't realize there's a huge benefit of just being outside. All right, number 5. Let's say you start getting a frequent and excessive thirst, okay? You're extremely thirsty, just out of the blue, your mouth is dry, you didn't exercise, it's not hot out, you're not taking a lot of potassium or an electrolyte, and also you're not taking a diuretic, but you're extremely thirsty, and you have to pee a lot. Well, that could mean that you have diabetes because what's happening is the kidneys are going to dump this excess sugar, and wherever the sugar goes, the water goes. So get it checked. Check your blood sugars. Of course, if you've been watching my channel, you probably are not going to have this because you've been implementing all these wonderful ideas about going on a ketogenic diet and doing intermittent fasting. So this is really about, you know, your friends and family that might have this symptom. Just because I've heard stories about people having super high levels of blood sugars but not knowing it and then having all these symptoms, I mean, you can literally go into a coma if your blood sugars are too high. So you won't have to worry about that if you keep your carbs on the low side. Okay, number 6, resting tremors, okay? Now, that can happen because you're tired. It can happen because you haven't slept that well. It can happen right after exercise, but it could also potentially be the early signs of Parkinson's disease, okay? So if you start noticing a resting tremor and your gait is slowed down and you become very, very stiff and rigid, and you have a masked face where your face looks very, very serious or very depressed, yet you're not depressed or serious, that could be early signs of Parkinson's. But also it could be that you have what's called metabolic alkalosis. So your pH, your blood pH is on the alkaline side, okay? Tremors is one of the symptoms. And so if you also have like tetany, like twitching or muscle cramps, it just could be a pH problem. So it's just something good to get checked out. All right, number 7, some changes in the breast tissue. So let's say you're female and you notice a lump in the breast or in your armpit. You might want to get that checked out because that could be the early signs of a tumor. But here's the thing. There's a thing called fibrocystic breast, okay, where there's a cyst developing in the breast tissue. And it's not necessarily cancer, but it is a cyst, which is different. So I just want to mention this because the most powerful remedy for that, it seems to work like nearly 100% of the time, is sea kelp, okay? Because the iodine in sea kelp helps to modulate or control estrogen dominance in the body. And so it really dramatically will get rid of ovarian cysts and cysts in the breast tissue. So if you do have some lump and you take sea kelp and it doesn't go away, get it checked out. Last one, let's say you have blood in the stool, okay? You don't want to ignore that, but realize it could be a hemorrhoid. It could be some ulcer in your large intestine. Let's say you have some type of inflammation and in your large intestine or even your small intestine, that can create blood in the stool. Or let's not rule out that you just had some beets. That can make your stool red. Or it could be colorectal cancer. And so it's very good to know about this as early as possible so you can do something about it. So the point of this video is not to ignore your body's communication to you, but to get more data in your evaluation so you can have knowledge and do something about it. Now, if you haven't seen my video on how to get so healthy that you can prevent and avoid all these things right here, I put it right here. Check it out.